We are here today for National Infant Mortality Awareness Month, and we are joined by Pat Keating, the Fetal and Infant Mortality Review Community Action Team co-chair, who will speak after our proclamation. We have Jade Ann Rennie, the Fetal and Infant Mortality Review Board co-chair as well. She'll speak as well, and then we're also joined today by Dr. Carol Garvey and Becky Smith. So thank you for joining us today, for being part of this, and Sheila O'Connor as well. The U.S. infant mortality rate is 84% higher than the average of comparable countries, and the rate is not improving here at a similar rate to those other countries. Among those startling statistics, there are significant racial disparities in infant mortality rates in the United States. Black people experience the highest infant mortality rate among all racial and ethnic groups, as well as the highest rates of preterm birth, low birth weight, both of which are the leading causes of infant death. Black women, in fact, are 3 times more likely to have a low birth weight baby. Pregnant people who are American Indian or Alaska Native and Native Hawaiian or other Pacific Islander also experience a higher than average infant mortality rate. The infant mortality rate among Hispanic mothers is like the national average, while rates among white and Asian mothers are lower than the average. Structural racism is a primary risk factor for African American mothers and their infants, largely due to complex stress it places on mothers throughout their life. Black women who report high levels of racial discrimination are 3 times more likely to give birth prematurely and 5 times more likely to have a low birth weight baby. And you'll probably hear from our experts, of which I'm not, but racism causes stress, and that causes cortisol. And pregnant people who already have elevated cortisol levels contribute to an excess of cortisol that reduces blood flow to fetuses and causes a myriad of health issues. Well, we're here to raise awareness about fetal infant mortality. Maternal morbidity is a related and equally consequential issue in need of our attention. According to Montgomery County Improved Pregnancy Outcomes Program, Fetal and Infant Mortality Review Board Community Action Team Fiscal Year 2020 Annual Report, while maternal mortality was very low, severe maternal morbidity was higher here than the national average. Black, African American, and Hispanic women were 61% and 46% respectively more likely to experience severe maternal morbidity than white women. So we're here to talk about these issues. We're here to raise awareness for these issues. We're here to promote awareness of the racial disparities that exacerbate these issues, to identify and address unconscious bias in healthcare here in Montgomery County and throughout the country, to encourage patient empowerment, and to encourage more BIPOC, particularly Black students, to join medical fields. Black newborns in hospital death rate was 1/3 lower when Black newborns were cared for by Black physicians rather than white physicians. So we're here to raise awareness. We're also here to express our gratitude to those who are in the field actually doing this work, who are partnering with county government, who are working in and volunteering with county government to really make a difference. And I'm just really appreciative and grateful for our guests who are here today. So I'm going to read this proclamation, then I'm going to turn it over to our guests to provide the expertise that I lack on these important issues. And I'm just very grateful that we're here today to lift up what is a critical issue in our community, affecting mothers, affecting pregnant people, and affecting our children. So we have a proclamation from the Montgomery County Council. Whereas, according to the most recent data available, the infant mortality rate in Montgomery County over the last 5 years was 3.8 deaths per 1,000 live births, which is lower than both the Maryland and U.S. rates. And whereas, despite this low rate of infant mortality in Montgomery County, disparities by race remain. Due to historical and social inequities, the rate is 6.2 per 1,000 live births for Black women in our community, which is double the rate for white and Hispanic pregnant people. Furthermore, Black women continue to experience more than 1/3 of all losses, despite accounting for less than 1/4 of all births, which starkly illustrates the disparity in outcomes. Whereas this disparity persists even among highly educated, higher income women with approximately 100 annual cases of fetal and infant loss in Montgomery County that occur across all socioeconomic statuses. And whereas nearly half of all individuals in Montgomery County who experience a fetal or infant loss in recent years started their pregnancy with at least one risk factor, such as advanced maternal age, obesity, and chronic health conditions like hypertension and diabetes. Whereas, through the support of the Montgomery County Improved Pregnancy Outcomes Program, the Fetal and Infant Mortality Review Board and Community Action Team promotes awareness of racial disparities in infant mortality, improves healthcare systems, promotes patient empowerment and health education, supports the evidence-based practice of nurse case management to support pregnant people in at-risk groups, and examines social determinants of health and implied racial bias when assessing trends in infant and fetal loss. And whereas Montgomery County, in observance of National Infant Mortality Awareness Month, encourages all residents, medical providers, and other community partners to promote education about fetal and infant mortality and the persistent racial disparities in birth outcomes, and support healthcare system changes to address these issues and strengthen community resources. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes September as National Infant Mortality Awareness Month, presented today on this 13th day of September in 2022, signed by myself, Andrew Friedson, and Council President Gabe Albernas. Now I'm going to turn it over to the actual experts, and first we'll start with Pat Keating. Pat? I'm sorry.
Yeah, that's okay.
As I said, not an expert, as evidence. So we'll start with Jane Ann. Thanks.
Thank you. Thank you, Councilmember Friedson. Good morning, members of the County Council. Good morning, members of the Fetal Infant Mortality Review Board and friends. I am Jade Rennie, Public Health Program Manager at the Collaboration Council and co-chair of the Fetal Infant Mortality and Review Board. I'd like to thank Councilmember Friedson for this proclamation recognizing September as Infant Mortality Awareness Month. We appreciate your interest in highlighting birth outcomes and related racial disparities in Montgomery County. The FEMR board is charged with reviewing cases of fetal and infant loss and developing recommendations designed to improve birth outcomes in our community. In Montgomery County, we typically have between 90 to 100 fetal and infant deaths annually. And although they fluctuate from year to year, infant mortality rates in the county have declined in recent years. However, as the proclamation makes clear, Black African American women experience a disproportionate number of these tragic losses and have an infant mortality rate more than double that of white women. The FEMR board examines a wide range of factors that may have impacted the course of the pregnancy, including environmental factors and other social determinants of health. It then makes recommendations to the Community Action Team, which was created to carry out key initiatives. Every recommendation has the same goal: to support healthy pregnancies for all women in Montgomery County, thus ensuring that infants are given the best possible start. By increasing awareness of the prevalence of infant mortality in our community, we hope to build on current efforts and continue to identify solutions to these heartbreaking losses. Today's recognition goes a long way towards helping accomplish that goal, and we thank you for your support. I'll now turn it over to our FEMR Community Action Team co-chair, Pat Keating, who will now make a few comments.
Good morning, Councilmember Friedson, members of the County Council, and FEMR Board and Community Action Team members and supporters. I am Pat Keating, co-chair of the Montgomery County Community Action Team. I'm a registered nurse and recently retired as the manager of maternal and child community health education at Holy Cross Hospital. As Jade Ann noted, the Community Action Team works to improve healthcare systems and strengthen community resources by putting the key FEMR board recommendations into place on the ground. Our initiatives range from promoting good preconception health to ensuring that women are linked to a medical home throughout their childbearing years and receive early and regular prenatal and postpartum care. Our efforts frequently involve outreach to OBs and other medical providers, as well as direct outreach to women of childbearing age, especially women of color. We are able to make system improvements because of our dedicated healthcare providers, community agencies, and other public and private institutions who work together on the Community Action Team to improve pregnancy outcomes and address the persistent and alarming racial gap in infant mortality. Our team understands that community awareness of these issues is crucial and is the first step towards pushing for needed changes. We applaud the current spotlight on racial inequities in health and know that addressing this requires action at all levels, from decision makers in government and the private sector to individual women of childbearing age and their partners. Today's proclamation is a very welcome event and one for which we are grateful. We thank you for shining a light on infant mortality and proclaiming September as Infant Mortality Awareness Month.
Well, thank you so much. Clearly, there's a lot of great work being done in Montgomery County that we're very proud of and very grateful for, but a lot more work that needs to be done. We hope you'll join us in raising awareness for this important issue. We have a panel discussion coming up next month, so stay tuned for more information about that. And thank you so much for being part of this really important effort and helping raise awareness. We're going to take a picture now, and if colleagues want to join, please do so.